And then by the fourth year of medical school, you're supposed to have seen enough that you narrow down what you'd really like to do to 2 or 3 different possible areas of medicine, and then you take some electives in those areas, and then by the end of the fourth year of medical school, another set of board exams, so you have to pass those, and then you apply to residency. And residency is, I tell people, it's sort of like an apprenticeship. You know, in the old days, if you wanted to be a blacksmith, you worked under a blacksmith, you learned the trade, right? And this is no different, really. Residency is where it's hands-on, taking care of patients, but you're supervised by staff, by a full-fledged psychiatrist, let's say. And you do that for about 4 years. For psychiatry, it's 4 years. It's variable. Internal medicine, family practice, and pediatrics are about 3 years of residency. And then surgery, the different types of surgery are somewhere between 5 to 7 years. I think OBGYN now is 5 years. So it depends on which area you want to go into as to how long it takes. But for our purposes tonight, psychiatry was 4 years. So we did 4 years of college, 4 years of medical school, and then 4 years of residency. Now, believe it or not, you can still go further. If you want to specialize in some type of area of psychiatry, let's say geriatric psychiatry or child and adolescent psychiatry, and if you want to be board certified as a geriatric psychiatrist, you have to do 2 more years of what's called a fellowship, and then take another test. So after the 4 years of residency in psychiatry, you take the board exams, again, another set of exams. You pass those, you're board certified as a psychiatrist. But then if you go to 2 years of geriatric fellowship, you have another set of tests you take, and then you're a geriatric psychiatrist, board certified. Okay? What I've done is I did the 4 years, and then I stopped. I didn't do any extra specialization because I thought 12 extra years is plenty, and I'd like to get out there. I was 30, at the time, and that's about on time, about what the age people would be if they did everything without, having to go back and redo anything. So that, as you can tell, that's quite a bit of training. I mean, that's not, when somebody says they want you to be a real doctor, I mean, we're pretty much real doctors, and we're going through all the same stuff as all the other doctors, so we're real doctors. I think the problem comes in that psychiatry, we don't have a lot of tests that we can do, scans we can do. It's not a hands-on profession. It's more abstract. I think other doctors and people have trouble with that sometimes. Now, people really get stumped by what's the difference between a psychiatrist and a psychologist. You ever thought about that? Psychiatrists can prescribe medications, exactly right. I mean, the way the psychologists are, and actually, it's funny you say that because there are now 2 states in the country where there are laws that a psychologist can take a few extra classes and prescribe medicines without going through medical school and all that other stuff. So that's kind of controversial. Psychiatrists and really a lot of psychologists are not too happy about that. But I mean, the issue was that there weren't enough psychiatrists. Somebody needed to do it, and so they decided they would push for these laws in these states, and they made it. So, but in general, you're absolutely right. In general, psychologists, the training is a little different too. So the psychologist goes through 4 years of college at least, and then they do a graduate school. And graduate school, it can be 5 to 7 years. And graduate school can be either a lot of research, more research oriented, and you get a PhD out of that. So you're still a doctor, but it's not an MD, not a medical doctor. You're a PhD doctor, doctor of philosophy. And now on the other hand, there's also a psychologist. Psychologists can also go through graduate school and get what's called a PsyD. And a PsyD is more of a clinical degree. They're called doctors. I worked with one who was outstanding. She's going to actually do a talk for me, I think, in May on eating disorders. So she's very good, but she can't prescribe medications. So she didn't go through medical school and learn all the physiology and all the pharmacology and all the stuff you got to have to prescribe, to know enough about medicines and everything and how they affect the body. So she's an expert at doing psychotherapy, talking to patients, and also some testing. Psychologists are really experts in testing. Testing would be things like IQ testing if somebody thought somebody had ADHD and you're trying to find out, or dementia. Sometimes we're not sure if somebody has dementia, so we'll have them go through, it's quite a lot of testing. It's about a half day. They'll sit down and they'll go through all these different areas that the brain, things that the brain does, and they'll test all of these things, visual, spatial, and all the memory and all this stuff. And so the psychologists are the experts at that. Psychiatrists are trained to do psychotherapy and medication management and really see the patient as a whole, but we're not really that good at testing. So that's one area that we're not so hot, and psychologists have us beat in that area. Not that it's a competition, but we each have our own expertise, and I guess that's one way to think about it. So in summary, a psychiatrist is a medical doctor that goes through, it's a real doctor, goes through medical school, and is an expert at diagnosing and treating illnesses such as depression, major depression, bipolar disorder, schizophrenia, anxiety disorders, all these things. And they can use either psychotherapy and or medications to do so. Now, on a day, what does a psychiatrist do on a day-to-day basis? What are the different types of what are the different practice types, I guess, of a psychiatrist? I put this in here because I thought, actually know that some folks are going to be interested in maybe pursuing psychiatry. I've had some folks on YouTube who've said, hey, psychiatry looks pretty good, I'd like to do this. And also somebody I work with, her son's interested in psychiatry, and I promised him I'd talk a little bit about what if you become a psychiatrist, what can you do? So obviously you guys probably can imagine private practice is one thing. So you own a practice, you have office staff that work in the practice with you, and you see patients in a clinic, and you're in charge of all that as sort of the business person, but also the doctor. So that's one area that one thing a psychiatrist can do. There are a lot of places we can be employed. So where I used to work, I worked at a community mental health center, and a community mental health center it's basically a mental health treatment center. So there are you can go in and see the psychiatrist only. You can see the psychiatrist and a therapist, do psychotherapy, all in the same, usually in the same building, And there also are typically services for folks that have more chronic mental illness like schizophrenia, and they'll come in and they'll have day treatment, where the folks will be in there during the day, and they'll learn different things to help them cope in their lives and things like that. And they also have group therapy and such. So the community mental health center, the one I worked at, I was employed by them, and took care of the folks that they needed me to see. And I actually liked the model that we had because in a few minutes I'm going to explain where I think somewhat the system is broken sometimes, in that the psychiatrist is doing medications for 10 or 15 minutes with a patient and is not doing any psychotherapy. And I don't know that that's the best thing in the world. And if you can't have that, which sometimes this day and age you can't, I think the next best thing was what I had in the model where I was working, where I would see the folks for medications, and then the psychotherapist would see them for psychotherapy, and I would meet with all the psychotherapists every week. We'd meet for an hour, and then usually more than that, where we would discuss cases and if there was any concerns or anything that was happening. So I would share how's it going with the medicine, how it was going with the medicine with the therapist, and the therapist would say, hey, she's dealing with this, this, and this in her life too, so be aware that that she may be getting a little worse even with the medicine and so on. I think that was very effective. It's not always like that, unfortunately. But so that's kind of the idea behind community mental health centers. Most towns have them. They can look a lot different depending on the town. So if it's a small town, they may be the only place that people go or can go for treatment. If it's a bigger city like Indianapolis, let's say, in an inner city like at Midtown, where I trained in residency, that's folks mostly that are indigent and have chronic mental illness. Okay. Some psychiatrists also you can also work in a correctional facility like a prison or something where you're seeing the inmates. You can also work in a state hospital for psychiatrically ill patients. State hospitals like Richmond State Hospital around here, and you guys have heard of Madison State and Central State, and all these. The state hospitals are places where folks that have more chronic illness that isn't really responding very well to the treatments that we have, or they can't, no matter, even if they get the best that they can get, they have trouble functioning on their own outside of the hospital, so they need a lot of support and a lot of structure. So psychiatrists can work in these state hospitals taking care of folks. You can work at a university. Basically, like I just said, you can train residents and medical students, do research, and also see patients at a university hospital. You can work at a pharmaceutical company like Eli Lilly or Merck or one of these places. If you're a psychiatrist, typically they'll hire you for some kind of neuroscience drug, some kind of drug that would be used in psychiatric illness. That